Welcome, everyone. I see folks are still joining, so we'll start in just a minute or so. Thank you for being with us today. Welcome, everyone. I see numbers are still going up a little bit, so just wait 1 second before we get started. Just a couple announcements. We are recording this meeting. We also have ASL and captioning available. So for if you'd like live captioning, you can click on the CC button located at the bottom of your screen. For real-time interpretation to ASL, please see the pinned video on your screen. And if you would like Spanish interpretation services, please click the globe, which is on the bottom of your Zoom toolbar. So again, thanks for joining. Today, we're so happy to be here with the Doris Duke Foundation. I'm Lisa Morawski. I'm the Communications Director for the Oregon Department of Human Services. I use she, her pronouns. A few other housekeeping details. We're going to spend the last 15 minutes or so answering questions. So we'll have some speakers for the first half of the meeting, and then we'll move into questions and answers. You can use the question and answer chat, which you'll see in the bottom of your Zoom toolbar, to enter your questions, and we will pose those to the panelists. We'll get to as many as we can, and we can follow up if we don't have enough time. Again, the webinar is being recorded, and on the screen there you'll see how you can access captioning and ASL. So again, thanks for being here. We have a special announcement that we're going to share with you along with the Doris Duke Foundation that will deepen the work of ODHS with Oregon's children's and families. Today speaking, we have a panel with ODHS Director Fairbourse Paxarasht, Ju Chang, who's the Doris Duke Foundation's Child Wellbeing Program Director. And we also have Tricia Edisted, who is a parent mentor in Clackamas with Morrison Child and Family Services. And Tricia will be speaking to kind of examples that she's seeing in the community of why there's such a need for this new program. Also joining us today, we have directors of two of our programs who are partnering on this initiative, Claire Seguin, who is the director of our self-sufficiency programs, and April Flint-Gerner, who's our child welfare director. So we will go ahead and get started, and I'm going to turn it over to Fairbourse to get us going.
Thank you, Lisa, and good afternoon, everyone. Thank you so much for joining us today. I'm excited to share an important announcement. Oregon is one of 4 states selected by the Doris Duke Foundation for a new initiative to help support families and prevent child abuse and neglect. We all know that every child is filled with tremendous promise, and we have a shared duty to foster their potential. That means shoring up the ways we support families. Called Opt-in for Families, this innovative public-private partnership will help facilitate healthier communities, families, and youth. Historically, child welfare systems have been centered on removing children from their homes to keep them safe. Oregon and many other states have realized that this approach, though at times necessary, has harmed many families by separating children from their communities, not because of abuse, but because of poverty, hardship, and unmet needs. This separation of families has disproportionately affected Black and American Indian communities, causing generations of trauma. We can change this narrative by earlier intervention and providing support to families who are struggling with meeting basic needs. Oregon already has implemented pilot programs around the state to explore new approaches to partnering with communities and supporting families with the goal of keeping them together. Our self-sufficiency programs, which administers food and cash assistance and other basic needs programs, has been partnering with child welfare to provide families with the services and supports they need to achieve stability and reduce the need for child welfare intervention. Opt-in for families will build upon this work and allow us to expand and reach even more families and communities. The grant will provide technical assistance to Oregon Department of Human Services to help families who are reported to Oregon Child Abuse Hotline and determined to not have engaged in child abuse following a screening process. These reports often indicate serious economic needs and other hardships that, if not addressed, can result in neglect. Opt-in for families will link these families to voluntary assistance programs from community organizations and Oregon Department of Human Services self-sufficiency programs. We look forward to working with the foundation and local community-based organizations to design a program that will work best for Oregon children and families. We are extremely honored and grateful to have been selected by the Doris Duke Foundation to participate in this initiative. I'm pleased to introduce Ju Chang, Doris Duke Foundation's Child Wellbeing Program Director, to speak more about their vision for the initiative.
Great, thank you so much, Director. Again, I'm Ji-Yun Chang. I oversee the child wellbeing work at the Doris Duke Foundation, which is a national foundation whose mission is to build a more creative, equitable, and sustainable future by investing in artists and the performing arts, environmental conservation, medical research, as well as child wellbeing, and promoting greater mutual understanding among diverse communities. We are so proud to work with the extraordinary leaders and community members in Oregon to demonstrate once and for all that it is possible for us to create a system response that helps children and families thrive. We all know that our decades-old child welfare system is in need of reform. There's a crucial gap for the 7 million children across this country who come to the attention of the Child Protection Services system every year, but really don't need that type of response. What they need instead is a helping system that can help meet those families' needs at the first signal when they can get served by their community members before those problems turn into crises. Oftentimes, a call is placed to the CPS hotline where the question that's asked is whether this child is safe. Unfortunately, that's often where we stop asking questions. We think that if a child is safe, as the director said, but was called into the hotline, maybe there's another question we need to ask. And the question we think we need to ask is a question for the family, which is, what is it that you need to be well and to thrive? The Doris Duke Foundation wants to work with local jurisdictions and trusted community-based partners to step in and help families when these needs exist. Research shows us that when we are able to provide families with early intervention, when they're facing a particular hardship, it helps families stabilize and to avoid crisis and downstream system involvement. We know what it takes to prevent situations from escalating to the point where families are at risk of family separation. The Doris Duke Foundation is launching the Opportunities for Prevention and Transformation Initiative for Families to create and test a meaningful alternative to the current system. This is a 3-year, $33 million investment by the foundation to really prove that a different way of doing business is possible. And our partners include not just Oregon, but also the District of Columbia, Kentucky, and South Carolina. We aim to really be in a partnership in a space of learning to understand which families need what kind of engagement, what type of services and supports, for how long, to address and address needs and prevent those needs from escalating into crisis. Our goal is to demonstrate that actively connecting families to coordinated support in partnership with trusted community members, along with direct support for basic needs, is a cost-effective, scalable way to prevent abuse and neglect and to keep families together. Thank you so much to all of our partners in Oregon. And with that, I am so happy to turn it over to Tricia.
Thank you, Ju. Hello, everyone. I am Tricia Edestad, and I am a parent mentor in Clackamas County for Morrison Child and Family Services. We have a contract with ODHS for self-sufficiency program. I'm happy to be here today to share a bit of my experience with you. My work as a parent mentor is directly linked to my personal experience with child welfare. And about that, I'm a person with lived experience, and I am a parent in long-term recovery. So I am passionate about working with others who are maybe in the same situation, to meet them, right where they're at, and just show up at their door and help them with whatever they need help with, whether it be a phone call or transportation or emotional support. And I started being a parent mentor 8 years ago. And what we realized after the mentor program was started was that many of the parents that were timing out on their TANF, they were not ready to just go to work. They were not ready to just be employed. And so our role as mentors to help reduce the barriers for parents and support them, support them with a substance use disorder, or help setting a doctor's appointment, like they said, or getting long-term rental assistance was something that we were helping them do. And parents, I feel like parents are falling through the cracks. And so my hope is that we are able to prevent that from happening by possibly, giving them assistance after they become employed, because I know once you become employed, you actually lose all your benefits. And so it's kind of difficult to become employed and then lose all the benefits. And then, it causes a trickle effect, honestly, to go into depression and to make you not want to work, really, because then you're just working to pay for childcare. And so there's just so many scenarios and barriers to that. And I'm just really hoping that we can help these parents financially, get stable and stay stable. And I love my job, and I am grateful to be here. Thank you.
Thanks so much, Tricia. Well, we are ready to take your questions. So again, if you want to type your questions into the Q&A chat function that's on the bottom of the Zoom, we can start taking your questions. I can start with one question for Claire Seguin from the self-sufficiency programs. Can you tell us a little bit more about what you mean by prevention?
Yeah, hi, everybody. Thanks, Lisa. So child welfare and self-sufficiency programs look at prevention and anti-poverty work a little differently. Self-sufficiency and ODHS in general want to make sure that we are doing more than just connecting families directly to benefits. We're actually trying to establish relationships with our family coaches where we wrap around families, let them be in the driver's seat so that we can bring to bear all of the resources that they might need in an upstream prevention sort of mindset. We know that we have a lot of resources internally at ODHS, but we also know that the community holds the key in terms of all the additional resources that they might be able to bring to bear. The other thing that we're looking at really is the idea of the flexibility and the innovation that Ju's referencing through the Doris Duke Foundation's work. We are looking for innovative ways to reach families and to look at the supports that they might need that we may not have thought of before. And I'll share one example where it's working already. Recently, we passed a policy where we could establish some TANF funding, some temporary assistance for needy families, to help families 3 times a year with a clothing allowance. Now, this is cash for them to buy clothes for their kids going to school or to maybe buy those winter coats, because we were hearing that kind of a message from families. And so looking at innovative ways that we work to hear from the families and to meet their needs is really what this whole objective and project is about. So we're excited about that. And we're excited to bring the family coach sort of navigation to our families in new ways together with child welfare. So it's a really exciting project. Looking forward to all the learnings that come out of this. So thanks, Lisa.
Thanks, Claire. We have another question. Will there be a qualifying process for services, and what will that look like for families? And I'm going to ask Jennifer Holman to take that question. She is with ODHS, and she is the Family Preservation Manager, working for both the child welfare and self-sufficiency programs.
Thank you, Lisa. Thank you for the question. So will there be a qualifying process for services, and what will that look like for families? So as Director Paxaresh said earlier, and Ju said, we're really looking at understanding and exploring different ways to support families proactively. And so we'll be looking at a couple of different projects for opt-in for families. And so they are focused on looking at those closed debt screening reports that come into the child abuse hotline. So we'll be looking at 2 things: one where self-sufficiency is supporting families, and one where community partners are supporting families. So really, we're going to look at understanding what families have calls of concern coming into the hotline, and how to best support families. So part of this project is really understanding which families we'll be looking at offering support to. Not every family that has a call of concern coming into the hotline needs any sort of contact from folks. And so we really want to understand that, so we're not continuing that over surveillance that Ju was referring to when she was talking. So we're kind of really exploring that and want to understand it a little bit more in terms of what this will look like for families. And so really it's around proactively reaching out to folks and offering supports and services in a voluntary way.
Thanks, Jennifer. Another question let's see, I think, Jennifer, this might be a good one for you as well. Will you be seeking proposals from agencies and programs to help provide these additional coaching services?
Yeah, thank you for the question. So right now we're looking, as I said before, at 2 different ways of kind of working with families and offering these supports. One is through a community provider, and one is through our self-sufficiency programs. And so that is involved with our family coaches, as Claire referenced earlier. So those folks will proactively be reaching out to families. So we have those internal folks in place to continue to do that really great kind of wraparound service for families. And then we're looking again, the second part of it is looking at what would it look like for those closed debt screenings to then go to a community provider and provide support. So we are working with a community provider in the Multnomah area to kind of understand that and look at it. And as Ju referenced, really with the goal of understanding how to build capacity and spread if we're seeing that that's positively impacting families. So after we learn that, then yes, we'll be looking at how do we grow capacity and spread it to other community organizations.
Thank you so much. Another question, and Jennifer, this may be you too, so you might want to stay on camera. How do we ensure that the youth are feeling heard and taken care of throughout this process, rather than them feeling that everyone is siding with their parents who they feel abused or neglected by?
Yeah, great question. Thank you. That's one of the really important parts about this initiative is, and again, I think one of the reasons that Oregon was selected for this award is that there's already really intentional work going on with self-sufficiency and child welfare about bringing diverse voices to the table so we can understand how to better serve our communities. And that includes youth voice. And so what part of the work that's being developed is an advisory group is being developed, and that's with another partner in this work, Foster America, to bring together a very diverse group of folks that is really built from people in the community, folks who have been impacted by the system with different voices to really co-design, and in some cases design what this project, what certain parts of this project will look like. So we're working really intentionally with Foster America and Think of Us, which is another program as well that's really focused on bringing in the voice of folks who've experienced our system, both as parents and children. So I appreciate that question, and we're going to do everything we can to honor those voices. And instead of sort of saying, here's what we've thought of, what do you think? That it really is a partnership and a co-design process.
Thank you so much. A question for Ju. What outcomes do you expect to see from this initiative?
So a couple of things. I think it's a two-part answer because part of the outcomes will be determined by Oregon and the stakeholder group that Jennifer mentioned. We want this to be a project that we provide some support for, but really is owned by Oregon and the community itself. But certainly at a national level, some of the overarching goals that we have is I would describe in two parts. One is that you know, I've been in the child welfare field for 20 plus years, and as long as I've been a part of it, people have been really unsatisfied with the child welfare system that we have. And what I'm hoping is that as a result of this demonstration across the 4 sites, that we will have a renewal of hope and optimism that we actually can collectively work together to design and build the system we want, instead of just dealing with the system that we have. I hope that it sparks imagination and creativity. And then on a kind of more granular, on the ground level, I hope that we can show that these types of investments in community partners and in families themselves, as well as providing some concrete supports to families, will prove that children are safer. And some of the proxy measures of safety that we're interested in at the foundation are, you know, how many calls are coming to the hotline, how many repeat calls, because we know that in many states, nearly half of the calls that are screened out will come right back into that system, right? We want to see a reduction in those repeat calls to the hotline. We want to actually track consumer satisfaction. Are families actually getting what they describe as what they need, not just what the services we have available to them? And also whether or not we see a reduction both in the overall numbers of children who are coming into the foster care system, but are kids safe while we reduce foster care? And most importantly, are we seeing some of the racial disparities in our foster care system reduced? And are we seeing just as many Black and Brown and Native American families being served in the prevention system that we design? So those are some of the kind of lofty outcomes that we have, as well as some of the concrete outcomes we want to see as well.
Thank you, Ju. We have another question that I'm going to ask April Flint-Gerner to answer. So the question is, curious if this might also be an opportunity for child welfare to identify specific mandatory reporter populations that might need more education, training, or information about what is a mandatory report of child abuse or neglect, and what else they can do to support families outside of a call to the hotline.
Wow, what a great question. I think this is going to teach us a lot, this opportunity to partner with communities upstream, learn from our communities who are most impacted by the long reach of child welfare. At the end of the day, when people call a hotline, they're worried about a child or they're worried about a family. And often people don't know where else to go. And so our hope is that as a part of our vision for transformation and as a part of this work with Opt-in and Doris Duke, that we are learning more about how we can educate the community about where those pathways to getting help exist. That doesn't mean don't call the hotline if you're worried there's an unsafe child. But in my opinion, there are so many things that we can be doing as a community to support children as well as making calls when we're worried that a child might be unsafe, but asking a family, what do you need today? And what would help you to thrive? That's just being a good community member, right? Regardless of whether you're a mandatory reporter or not. And we're really trying to work with this population, with our partners around the state of Oregon and around the nation to really figure out how we do increase the education around how do you know the difference between something that is just kind of an indication of poverty and something that is really about child safety. And as we continue to figure out what that looks like in partnership in Oregon, we are absolutely going to be doing a lot of these kinds of conversations and promoting conversations around how you can support families as early and as often as needed. Thank you.
Thank you, April. We have another question here. I'm going to ask you again to answer this one. The question is, I'm sure a lot of amazing work will come out of this. 3 years will fly by. Is there a possibility of renewing, or is part of the work to identify a sustainable funding source? Does Doris Duke Foundation have any longer term plans for the work?
Yeah, great question. And I have warned our board of trustees that we may be coming after 3 years to say we're not quite there yet, but we're on the right track. And so I am certainly willing to do that part of my job, which is to be your cheerleaders, to be your advocates within the Doris Duke Foundation. The other part of my job, though, is to take what we're learning to Congress. We really need to educate our policymakers about the realities of doing transformation work on the ground. I think far too often we think that passing amazing legislation is the end of the game. And the reality is that's just the beginning, right? That's what gives us permission to do extraordinary work. But the hard work of actually doing the change is when we actually learn what pieces of that policy need to be changed. How does it how do we improve it? Are there pieces missing? And so part of our work at the foundation is to collect those stories about how it can be easier for an extraordinary place like Oregon to do what it wants and to create this child well-being system and educate policymakers all along the way. Part of the reason that we launched here in Washington, D.C. is that we think it's really important for policymakers to know that places like Oregon are starting down this amazing road and that you'll have news for them all along the way over these 3 years. And so it'll be really important for us to collect stories about families, collect stories about success, and also the lessons that you're learning. And we are hoping that we can share strong evidence-based results to policymakers so that they'll be able to use that for sustained support over the long term.
Great, thank you so much. Well, that was the last question, so we'll go ahead and wrap it up. As we stated, we are recording the webinar, so we'll send a link out to all of you who attended. Feel free to follow up with us, anybody at ODHS, if you have any questions, want to be involved in this. I think we'll be working with a lot of community partners, so really look forward to that work starting here in the coming months. So thank you so much for your interest and for joining us, and have a great afternoon.